India recorded 3,016 new COVID cases in the past 24 hours, a 40% jump just since yesterday. The daily positivity rate has been recorded at 2.7%. Meanwhile, if we talk about the weekly positivity rate, it's at 1.71% as we speak. The country's COVID-19 death count has increased to 5,30,862, with 14 deaths, 3 reported from Maharashtra, 2 from Delhi and 1 reported by Himachal Pradesh in a span of 24 hours and 8 reconciled by Kerala. Now, several districts in Maharashtra such as Mumbai and Pune, Thane and Sangli as well have also reported a sharp rise in COVID cases. And if we talk about the national capital, Delhi too has reported an uptick in cases. To understand the surge in COVID infections across India, we have with us Dr. Ishwar Gilada, Consultant Infectious Diseases and Secretary General of the Organised Medicine Academic Guild. Also joining us on the broadcast, Dr. Sunila Garg, member of the Lancet Commission of the COVID India Task Force, as well as an advisor at ICMR and the World Health Organization. Thank you so much for joining us, doctors, on the broadcast this morning. Dr. Gilada, I'd like to begin with you. Now, by all metrics, there has been a rise in COVID-19 cases over several weeks. While we know these are numbers well within the comfort margins of health authorities, what is your assessment? What is driving this latest surge, and is there a need to worry at this point?
So thank you very much, Parmeshwar, for having me on this show. Basically, we need to understand one thing, that nobody understands COVID properly. Number two, we have a waning immunity, both to the natural infection as well as to the vaccine immunity. A lot of people have not taken the third dose. Third dose uptake has been between 25 to 30% in different states. So if you look at only second dose, people have taken second dose almost 2 years before. Now, we should not be only bothered about number of cases going up. We should look at whether relatively deaths are increasing, whether hospitalization is increasing, whether oxygen demand, ICU, ventilator demand is increasing. And what we find currently, that yes, there has been uptake. If you compare 1 month before and now, there has been 30 times jump in the country. Country used to report only 100 cases a day a month before, and now it is around 3,000 cases today. Yesterday there were 2,000. So the 30 times jump. But if you look at the weekly assessment, when there is a 54% increase in cases between last week and this week, the deaths are increased only by 23%. We don't want anybody to die. But if you look at who is dying, who is getting hospitalized, those which are with severe comorbidities, uncontrolled diabetes, respiratory problems, and those which are above 60. So what we need to do currently, that we need to, on one hand, the government sector and the lab sector, they should continue to have a good surveillance, good monitoring, good genome sequencing. But the entire public, entire people should not be bothered about what we are seeing in the sequencing, because as soon as we say XBB 1.16, we say, oh, the new wave of variant has come. But India has been since beginning of 2022, we had only Omicron, and Omicron only BA.2. And BA.2 did not allow BA.4 and BA.5. All these XBB, etc., they are originated from India with the convergence of 2 different subvariants of BA.2. Now, XBB 1 and XBB 1.15 and 16, they have come. Currently, almost 60 to 70% cases are XBB 1.16. So it may be highly infectious, but it is not fatal. But it doesn't mean that people should get infected. We should vaccinate those people who have not taken the third dose, particularly those which are above 60 and with comorbidities. And our policy should be robust, because when we start vaccination, we were keeping only for X class of people, then we lowered it down. Till today, vaccine is not available in the private sector. So when a doctor can give any other vaccine, like typhoid, hepatitis B and pneumovac, why can't they give, they can give flu vaccine, why can't they give COVID vaccine? But that is rationed. So I think we should have a rational policy. Secondly, there should be masking only for those people which have a minimal symptom, even running nose and a cough, because virus is going to come in and go out only from the nose and mouth. So particularly those people who have their elderly people at home, people with comorbidity at home, they should be very, very particular, including children and working class people. They will bring infection from society to the infected, to the people at risk at family, and back and forth. So we should be very particular about those things. Otherwise, for common people, nothing to worry. This after a very big major earthquake, there are always the ripple effects. There are always tremors. This is one of the tremors.
Right, Dr. Gilada, lots to unpack there, but very crucial concerns and suggestions at this point. Dr. Garg, I'd like to rope you in at this point, just touching upon something that Dr. Gilada just skimmed through. With the majority of adults and adolescents having taken their second dose at least a year ago, and with extremely small numbers opting for a booster, what would you say India is relying on hybrid immunity arising from vaccination and natural infection for extended protection?
Yes, that is important, that we did have, 2 doses of vaccine, and as you know, Omicron infection was there, everyone was infected. So we were, doubly vaccinated, and also we were naturally infected also. But then, the time came when we started seeing the cases, again now. But our precautionary dose was introduced, but very few people have taken that. That's almost about 33%. So the time has come where people should be taking their boosters. That is important, and our focus also has got to be on elderly and elderly with comorbidities. And people also, along with that, with comorbidities, they serve as our priority areas of attention, so that they have to come and take the vaccination fast. So this is where our national communication strategy plan, which is already in place, that means we have to sensitize national people, then, state people and district people, so that, this message goes loud and clear. At the same time, we cannot lose a sight of test, treat and track. That is important, and all the things have to go side by side. But another thing which I would like to say is that when we talk about the mask mandate, the hospitals, the closed settings like metros and all, when we talk of Delhi's positivity, which is touching around 14%, it is very important that in the closed places like metros and all, which is the lifeline of Delhi, it is there we should make, the mask mandatory, and we should be very observant. We should not be, I'll say that we should not panic, but we have to be watchful about the red spots and all that, and hotspots where we are getting the number of cases, so that we can take immediate actions around that point. But you see, as the vaccine is concerned, apart from the boosters, it is the companies, they need to relook at the strains of the vaccines which are in circulation. As Dr. Gilada pointed out, that we do have this XBB 1.16 variant, which is a recombinant. It's a combination of 2 viruses where, there is exchange of genetic material, but it is highly transmissible. That is important, because if we are seeing 50% rise in cases, we cannot be complacent. So this is where the states need to be sensitized. We need to be conscious. We need to be following appropriate measures, but genomic sequencing, testing of passengers also, we need to be vigilant about that part also. So overall, we have to take a holistic approach, and our systems have got to be ready with regard to the beds and all that, with regard to adequate supplies, with regard to financing part and the medicines and all that. Our system readiness has got to be there in place. So all these things together, we should not take it lightly. We have to be vigilant, and we need to keep watch on the number of cases. So as of now, and also the supplies. And but another thing which I would like to say, indiscriminate use of antibiotics should not be done. And plus,
very crucial point there, Dr. Garg. Yes, please carry on.
So that is important. And another thing is that we have now, in place home isolation, home management and all. So that is where people should not unnecessarily come to the hospitals and crowd them. So that is another important point I'd like to say.
Right. So I think it's fair to say that test, treat and track, so that no complacency seeps in, should be our motto at this moment. But in closed places also, like Dr. Garg just mentioned, like metros, etc., masks should be mandatory. But Dr. Gilada, many people we've been speaking to, they actually talk about the increase in the number of seasonal influenza, the H3N2 cases, and tests on patients often reveal an uptick in COVID-19 cases. Is this something you witnessed with your patients too?
Yeah, you see, 2 weeks before the H3N2 and H1N1, they were higher than COVID. And when we are sitting in clinics, we are getting baffled, where people come with environmental pollution, allergic bronchitis, or H3N2 or H1N1 and COVID. And we don't know what is it, because all of them have similar symptoms. And H3N2 test or influenza test is very expensive. So people were doing only COVID test and only COVID cases were found positive. But now we clearly see that COVID uptake is much higher and it is almost 100 times up in 1 month. And not only there are 100 districts in the country out of 600 plus districts which have more than 5% positivity. So what happens is the other 500 districts think that, my God, we are safe. That attitude is wrong. So for two things, that we always talk about pandemic preparedness for the nation. Similarly, there has to be a disease preparedness at every individual level or a family level or a unit level. We should be all prepared. We should be all thinking of that. Secondly, we promote vaccine only when people are dying, when more infections are there. Actually, vaccines work better when the infections are lying low. So this is a proper time to take vaccine. And therefore, whether Delhi is having 14%, Mumbai is having 10%, or some district is having only 1%, everybody is at equal risk. So the people should understand, if it was not there in the country almost a month before, it has come to such a level, 100 times going up. That means it will happen in the rural and hinterland also. So we should be particular. It is going to be pan-India. If you see graph of the world, in Africa also it is now increasing. In neighboring countries also it is increasing. Malaysia it is having a good uptake. So India has a 54% rise in 1 week, but there are countries where 100%, 200%, 500% rise in just 1 week. So I think it is pan-globe. This is going to have this kind of impact. But one thing is very clear. This wave is not going to be a big wave. It is not going to be like a Delta. Delta had already baffled us. Virus has to come here to stay, just like human being, and it's going to be symbiosis. We need to make friends with such kind of infections. We need to protect our elderly people. We need to see that comorbidities are always controlled. It's not only for pandemic we should control. So people, there is a Hindi couplet says, "Dukh mein sumeran sab kare, sukh mein kare no koe. Jo sukh mein sumeran kare to dukh kahe ko hai." So people don't look after themselves properly. They don't look at their immunity properly. Only when disease comes out, now we should take immune boosters. No, it is going to be pan-year or pan-light. So one should look after their life properly. Keep away from kind of habits which can mar your immunity. See that your comorbidities are well controlled. And I think whether COVID comes or any infection comes, we can overcome them. And anyways, is a man proposes, God disposes. No one is going to come and stay here for 125, 130, 150 years. So some diseases will keep on coming, whether it's a cancer or infections or man-made catastrophes, people are going to die. But at the same time, we should have very good preparedness. And I'm good that Dr. Sunila Garg also, we are on the same page.
Right.
That we talk about, even we started talking about before COVID, that there should be pandemic preparedness. And that should be the goal of the country and that should be the goal of the humanity.
Right. As we wrap, I mean, it's been more than 3 years after the pandemic began. There have been new variants, also an uptick in cases and hospitalizations, not just in India, but across the world. But thanks to Dr. Garg and Dr. Gilada, as they said, there's no room for complacency. We should remain vigilant and not panic. Thank you so much, doctors, for joining us and clarifying our queries. Several states are also planning to hold emergency meetings over this alarming rise in COVID cases this week, starting with Delhi today.